So we're always going to identify our patient by agency protocol. We are also going to follow state and federal regulations. We are going to abide by standard procedures or standard precautions, make sure that we're wearing gloves, hand hygiene. We are going to ensure patient safety and privacy, as well as promote good body mechanics. Okay, for removing stool digitally, we are going to, first of all, make sure that our fingernails are cut and trimmed. We are also going to be assessing their vital signs, see if they have a history of any cardiac problems. We are also going to be checking the physician's order, making sure that we have the correct lubricant, placing the patient on the left-hand side, which I don't have in this case, but he would be placed on the left-hand side. We would also make sure that we had a waterproof pad underneath our patient, as well as a bedpan. And we would also have a washcloth or some kind of rinsing or washing solution for his area for after we are done with the procedure. Okay, so to begin, we are going to make sure that we are ensuring patient privacy. We're going to drape our patient and by only exposing his buttocks area. We are going to make sure our finger of our dominant hand, our forefinger, and possibly our middle finger is lubricated. So with our dominant hand and our first lubricated, our index finger, lubricated finger, we are going to slide our finger slowly, and we are going to actually observe and see if there's any perianal irritation. We are going to rotate our finger and feel for the mass and rotate it around the mass or into the mass. We're going to ask the patient throughout this procedure to take slow deep breaths. So after we are rotating around the mass, we can start breaking it apart in smaller pieces. We can use our second finger and go in and kind of like cut it into little pieces. So as stool is coming out, we're going to be placing it in the bedpan. We are going to allow the patient to rest in intervals. We are also going to consistently reapply lubricant to our fingers. We're going to be assessing their pulse rate. So if their heart rate falls or their rhythm changes, then we are going to stop the procedure. Depending on the agency policy, we're only going to be using up to 4 fingers. And then in between intervals of this procedure, we can also suppositories. After the procedure is completed, we are going to set our bedpan aside. We are going to wash the area off, get our patient back into a comfortable position. We are also going to note the color, the amount, the consistency of the stool, and then we are going to discard the stool properly, and then make sure our bedpan is washed out. We are going to make sure that we take our gloves off, and we also perform hand hygiene.